All right, a lot of news coming out this week about COVID and where we stand. Joining me to sort it all out is Dr. David Winter with Baylor Scott & White Health. Dr. Winter, good morning. Oh, thank you so much for wearing your mask. I guess that's the big message.
I've got my mask on.
I've got so many questions for you from viewers. I want to start with the numbers because people are asking, Sonia, why the spike? Is it because there's just more testing? Does it have to do with the nursing homes, or does it have to do with the prisons? Where is this coming from?
Well, when you test more, you'll find more cases, no question about that. So the best measure is how many folks are getting sick enough they have to be hospitalized, and those are going up. So yes, there's more COVID being spread out there. There's more people getting sick with it, more being hospitalized. There indeed is a resurge or a new wave coming up. No question about that in my mind, Sonia.
So this is another good question from a viewer who says, please clarify hospitalizations. Does it mean visiting the ER, 24-hour observation, being admitted into a room, or the ICU? Can you distinguish that?
Yeah, the hospitalizations we count at Baylor Scott & White Health and around the state are folks that are admitted to the hospital. These are sick folks, not folks who go to the emergency room and go home, folks that are admitted. And those numbers are concerning. We've been pretty steady here for a while, so I want to emphasize that we've been steady, but the last week they have clearly gone up. And if you look at what's going on in our communities, people are walking around without face masks, they're getting close together. Perhaps they're not washing their hands as much. I think there's a reason for this. The virus has been the same. It's not more contagious. It's always been very contagious. But if we don't take precautions, we're going to see a spike, and we're seeing one right now. I'm very concerned about that.
What do we know as far as the latest research around how long COVID stays in the system? I spoke with a viewer who says that she and her husband both tested positive for more than 14 days. So is that common?
It's not common. There's one lady, supposedly she's had it now for 90 days. That's extremely rare. We know for most folks, if you get the virus, it's gone, if your symptoms go away, within 10 days to 14 days. That's for most people out there. But we continue to learn about this virus. We don't know if you get it, can you get it a second time? There have been some cases that show that. We don't know if your antibodies are positive, if that's a worthwhile test, because that may not mean that you're immune. We continue to learn. I think we'll know more in a couple of months, but right now we need to understand the virus is out there. The best test if you're sick is a swab. That'll tell you if the virus is there or not. It's very reliable. The blood tests are not that good right now, but we just need to assume that a lot of people have the virus, and if we're not careful, we're going to get it, we're going to spread it to somebody else.
So then do you suggest if you test positive, you go back and get retested? And then also, do you think there's a difference between the self-swab and the one that's administered?
You know, good questions. The self-swab, the problem with that, if you don't do this exactly right, you'll hit a false negative, meaning you really have the virus, but you don't get it on the swab. It's said that unless it goes way up there and hurts, it's not a good sample. It doesn't have to hurt, but in fact, the people that do the swabs for our hospitals, they're very well trained to get it way up in the back of the nose. That's very important to do that. As far as other testing, the blood tests, it's not that reliable right now to tell you anything except that it's in the community. If someone gets a positive blood test, says they have antibodies, it doesn't mean that they're immune. It doesn't mean they can go back and not shelter and not wear a mask. So it's not very important for a person to get a blood test, but the swab is the one if you're sick. If you're not sick, if you've been exposed, to get the test, what's it going to tell you? It's going to tell you that one day that you don't have it, but you could get it the next day. The problem we have right now is there's a shortage of swabs. There's actually a shortage of machines to test the swabs. Only so many we can do a day. So we're trying to prioritize. People with symptoms should get a swab to see. If you've been exposed, you should shelter for 10 to 14 days. Then you'll be safe whether you have symptoms or not.
So just to clarify, because I have so many friends who go, oh, I think I may have had it in December or in January, in February, before we really knew about this, and I want to get an antibody test. Are there any antibody tests that you trust, if these people were your patients?
Well, we know that the antibodies peak about 14 days after you get the virus, if you get it. But still, what is that going to tell you? Is it going to tell you that you're immune? Of course not. It does not say that. So we're discouraging to getting the antibody test right now because, again, there's a shortage of information, a shortage of machines. We need to make sure that we distance ourselves. If you get symptoms and been exposed, then you should be tested with the swab, not the blood tests. Anyone else now, it's hard to get that test done. We have a shortage of these supplies. I want to emphasize that because I've had a huge rush this week of people saying, my son got it, I feel fine, but I need to get a test. I can't get that test done right now because we are prioritizing people with symptoms so we can follow those folks.
Dr. Winter, thank you so much. I can't get through all these questions, but hey, luckily we have some time to chat next week again. Thank you. We appreciate your time and insight.